Good afternoon and warm welcome to all to today's one-day seminar on interdisciplinary.
1 minute. System nearby you should be closed. Only one or two system at some distance. Otherwise, such.
Good afternoon and warm welcome to all to today's one-day seminar on interdisciplinary research in pharmacy, National Education Policy 2020 Perspective, conducted by Vivekanand Education Society, College of Pharmacy, Chembur, in collaboration with Konkan Gyanpeeth, Rahul Dharkar College of Pharmacy and Research Institute, Karjat. Myself, Dr. Vaishali Zadav, on behalf of VES College of Pharmacy, wish to extend a warm welcome to VS Trustee in charge, Shri Bulani Sir, respected Principal Madam, Dr. Supriya Shidhe Madam, and Dr. Mohan Kale Sir, Dr. Anuradha Majumdar Madam, today's speaker for the day, and to all dear participants. I would like to now request Dr. Supriya Shidde Madam to express her views on today's program. Over to you, Madam.
Good afternoon, one and all. Respected Trustee Shri Gulani sir, Dr. Mohan Kai sir, Principal Dharkar College, and the resource person of the day, Dr. Anuradha Majumdar Madam, former Dean, Faculty of Science and Technology, University of Mumbai. So, as the audience is aware of National Education Policy 2020 and the new reforms that are expected through the policy, every college and every higher education institution is getting geared up with the outcome and the expectations from NEP. And to understand more about multidisciplinary research and its relevance with respect to pharmacy, we requested Anuradha Madam to be a resource person for the day. Dr. Anuradha Madam has a vast experience in the research and she has been instrumental as a Dean of Faculty of Science and Technology to make many new reforms in the and she has been always a visionary and she has a great application mind to envisage where pharmacy uh, discipline can move to and in what way the research can be fused with the NEP so that we can go to greater and more breakthrough outcome through the research. So we are really grateful to Anuradha Madam that she has accepted our invitation on behalf of VES College of Pharmacy and Rahul Dharkar College of Pharmacy. We really thank Madam from our heart and we are really eager to hear from Madam about today's topic. So without wasting much of time, I would straightly like to hand over the platform to Madam or Vaishali Madam to take it forward. Thank you.
Thank you, Madam, for your words of wisdom. Now, I would like to request Dr. Mohan Kale Sir to say a few words on today's topic. Over to you, sir.
Good afternoon, one and all. Let me express my deep sense of gratitude to Anuradha Madam as well as VESCOP and its management, Dr. Supriya and Gulani sir, for having this collaborative project. Our college has signed MOU with VESCOP as well as Bombay College of Pharmacy in last month. And it's really good beginning to have Anuradha Madam to open the session of this collaboration, and that too for the faculties. Having a topic that is national education policy and interdisciplinary research, which is very, very important topic uh, from recent point of view. As well as I would like to congratulate Dr. Anuradha Madam as well as Vandana Patrawale on this platform and inform all delegates, participants from Mumbai that both had represented as resource person in Indian National Congress, which was held at Nagpur last week. So congratulate Madam for representing pharmacy fraternity there. And your talk as well as Vandana Madam talk were very impressive, which I got feedback from the all newspapers from Nagpur. Thank you. I will not take much time. Directly to Vaishali Madam.
Thank you, sir, for expressing your views. Now, I would take this opportunity to introduce resource person for the day. Dr. Anuradha Majumdar, Madam, is presently working as Associate Professor of Pharmacology in Bombay College of Pharmacy, Kalina, Mumbai, and has total 24 years of experience. She was holding the position of former Dean, Faculty of Science and Technology in Mumbai University from 2019 to September 22. She has made committed efforts for upward benchmarking of academics and research during her tenure, and Mumbai University was also graded with A++ during NAC accreditation. Madam has 37 international papers, 10 national, 1 general research publication, 4 Indian patents, and 1 Indian patent to her credit. She has also trademark on file trademark for Health Hamesha TM for a developed mobile and internet app on health information for common citizens in English and many Indian native languages. She has received 13 government grants of total amount rupees 1 crore. She has also worked on various industry projects and received a funding of about 75 lakhs. Her ongoing prestigious international transdisciplinary projects, to name a few, like microplastic pollution from ports and shipping, activities in the Indo-Pacific potential risk and mitigation strategies. She is also the collaborator for University of Tasmania, Australia, and many more. With this introduction, now I would request Madam to take over the session. Over to you, Madam.
Thank you, Vaishali ma'am, for the kind introduction. At the outset, I'm privileged to see Mr. Bulani there at VESCOP. So thank you, sir. It is a privilege that you are there to hear me, and I'm getting jitters that, that you'll be hearing me, and I hope I speak properly. Thanks a lot to our conveners of this event, Dr. Supriya Shidhe, Principal VESCOP, very dynamic principal. Dr. Mohan Kare, again a dynamic principal of Rahul Dharkar College of Pharmacy, Karjat, and I think both of them have been very proactive in throughout their tenure as principal, being prolific in hosting workshops, events, conventions, seminars like this, not only to aid in the what you call it knowledge sharing of their own institute and for the benefit of their students, but also for the fraternity, for pharma professionals, both in academia and industry. Highly appreciate your initiatives, and this is one of them, and this was very important. Similar kind of lecture I have given in around the last year towards the end in SNDT University, wherein all the vice chancellor and the entire team was there of the university of the PhD cell, and the students, the PhD students, and all the guides had attended, and it was a very good deliberation to understand how to gear up for NEP 2020. My wishes to all my colleagues who have joined from Westcop and from Karjat College, and all others who have logged in and who are watching us on YouTube. Wishes for Makar Sankranti. As Makar Sankranti, Pongal, Bihu, Lori, this marks a harvest festival. It also is the milestone, the yearly milestone and commemoration of Uttarayan, that is the movement of the sun, the celestial movement of the sun northwards, which earmarks, the summer months coming and progressive increase in the length of the day. And for us, the transition from Dakshinayan to Uttarayan is a very important phenomena which also shows sustenance and transition. Sustenance because sun sustains all life forms on earth, right? And the movement of the sun shows the dynamism of celestial movements and cosmic phenomena. Likewise, if I can draw a parallel and analogy to NEP 2020, we are also at the cusp of transition, major transformation and overhauling of higher education system. Also, that will impact primary and secondary education, but our focus is on higher education. One of the important aspects of NEP 2020 is, the flexibility with respect to entry exit, with respect to ABC, with respect to multidisciplinary focus. So institutions like Westcop, like Rahul Dharkar College of Pharmacy, who have already have associations with other colleges. Westcop themselves are associated with cluster of their own colleges, which is under the same management. They stand a lot of to gain a lot of advantage, because when we talk about multidisciplinary, they can do the liaising and collaborations with institutions under their own banner. So that's the benefit. I don't say that should be limiting. That is not limiting at all. But the MOUs, the collaborations would be much more easy and seamless. Education is meant to be borderless globally. We have seen with the signing of the Washington Accord way back in 1989. We became privy to it much later, India. So that was also to globally have a uniform, harmonized system of accreditation of engineering degree programs. So it started there. Then we know about the GATS, that is the General Agreement of Trade and Services. And as we are all aware that higher education forms a part of services under GATS. It's a trade service. And so there was a dire requirement for uniformity and harmonization. And our transition in 2013 from an annual pattern to a semester pattern was one of the initial milestones which we crossed, to be globally concurrent to the pattern of academic delivery, and that is the semester pattern. We see that if you see European Union is where the qualification framework started, so that the consortium of countries which are part of the EU can be part of the uniform European qualification framework. And if you see, the European qualification framework adheres to all the regional qualification framework under that area. And the main, if you see the terminologies and the jargons here, are the attributes, the graduate attributes, the skills, whatever has to be acquired at the end of a program at any level. It can be the level of diploma, it can be a level of degree, it can be a level of post graduation level, or the PhD level. So if we see that, it follows the pattern or the process called as the Bologna process. And the descriptors which are given, if you see the European Union qualifications framework in higher education, the descriptors are described by the Dublin descriptors. And these descriptors essentially have 5 elements in them, which we will also see the reflection of it in our higher education qualification, the national higher education qualification, which would also in certain cases include the skill qualification. The 5 elements therein, when we see the Dublin descriptors of their educational qualification. So basically the overall nature of qualification, we see that the first is knowledge and understanding amongst the elements of the Dublin descriptors. applying knowledge and understanding. This is what we try to achieve with our students endpoints, right? The attributes, performance indicators, right? These are what we try to capture in our direct assessment through qualification, or indirect assessment through their placements, higher education, and other yardsticks. So applying knowledge and understanding, making judgment, communication skills, remember that is very important, both written and oral, as well as learning skills. Remember, learning skills is very important because today we know that the pace at which science and technology policies is evolving over time, especially in this millennium. When we started, we saw changes from 2000 to now we are in 2023. So many changes, rapid changes, unprecedented changes, that every graduate or postgraduate has to learn lifelong to imbibe the newer skills, understand the newer policies, join the dots between the knowledge and skills which they have. So learning skills is one thing we need to imbibe in our graduates, and that's part of the descriptors associated with the higher education's qualification. So with this, I would like to share my presentation. I hope you enjoy it. Sir and madam, can you see my presentation?
Yes, madam. Yes.
Thank you. Thanks for the confirmation. So we know now that the new education policy 2020 will be implemented, and we are just, for our pharma fraternity, we are waiting for more directions and guidelines uh, from Pharmacy Council of India. But I'm sure that also will be concurrent with UGC guidelines, as was mentioned by the current president of PCI, that in terms of other rules, they are all now following PCI, the UGC framework. When we were asking him when he visited Mumbai regarding what are we following, are they following the AICT rules or they are following the UGC rules? So let's see how that comes out. I'm sure there must be a lot of deliberation. Overall, now in the future, the single institutions who are having flagship programs will have to become multidisciplinary. Many of the institutions, if you see the big ones in under the University of Mumbai or across all universities in Maharashtra and rest of India, have multiple faculties running. They have science, they have commerce, they also have arts. So but many times you'll find, but in pharmacy colleges you'll see that we usually tend to have our flagship program of B Farm. Later, we have consolidated that with M Farm and also maybe PhD program. So we will have to probably collaborate with other institutions under your banner, or independently institutions which are of great stature and having good ranking, so that we can in a partnership framework, we can also show that institution is multidisciplinary. We'll have to find out the modalities of how this to be done, and what the regulatory authorities is going to approve. So time will tell, and it will be very soon. So NEP 2020 has several key statements which probably gives the flavor and ethos of NEP 2020. For example, institutional restructuring and consolidation, technology use and integration, promotion of Indian languages, arts, and culture. We've seen that now engineering books and even medical and pharmacy books is going to come not only in Hindi but other native languages like Marathi. So, language no bar, right? Transforming the regulatory system will have a major overhauling. Even our accreditation systems has the NAC has declared the newer matrix. So everything, there is a change, there is a dynamic change. Effective governance and leadership, promoting high quality research, professional education, reimagining vocational education, I think there's also a amalgamation of vocational needs with that of professional in the professional programs. Teachers' education will make an important cornerstone in correct implementation of NEP 2020. Especially, see if the BSc, BA, BCom programs are going to convert from 3 years to 4 years. There's a lot of teachers training which would be required, and likewise to convert to have both 2 years masters and a 1 year master. I'm talking about the classical programs. Motivated, energized, and capable faculty, I think, and today this session is also towards that effect. Optimal learning environments and support for students, which we are all trying to give. Even before NEP came into the picture, this is what we try to offer to our students. Most important thing, towards more holistic education. When we got to know more about the qualification program in December, on December 12th, you can see that whether it is science or arts or commerce, they will have to take education of environment, they'll have to learn about a bit of statistics, they have to learn about finance, they will have to learn yoga and others. So they are trying to also include a bit of fine arts, liberal arts, right? Finance. So there is no, as you are seeing, the boundaries between the faculties are becoming more blurred towards a more holistic and multidisciplinary education. So if you read the NEP 2020, you'll see important mention of notion of a knowledge of many arts. So for having a graduate which who has a broader sense of understanding of the needs of society and the need of his fraternity or domain, it is very important that he has an understanding of many arts, and that is what the requirement is. For example, let's say a computer engineering graduate, when he comes up and we say, this is a small plumbing work or this is a small welding work, and he or she says, no, I don't know, I'm a computer engineer. Okay, so basic survival skills, life saving skills, sustenance skills, all these skills have to be ingrained in the graduates and the postgraduates, and irrespective of the discipline and faculty which they are choosing. Requirement of the 21st century. We've seen that the millennium, we are in the beginning of this millennium, things have changed so much. So, what are the requirements of today's era? Integration of humanities, arts with science, technology, engineering, and mathematics. So now we have to broaden our scope of thoughts. Not see this is science, this is pharmacy. You are a science graduate. We need to understand they all have to come together and give solutions to mankind and to society, right? And that is what multidisciplinary and transdisciplinary is all about. The fourth industrial revolution. When we talk about fourth industrial revolution and pharma, there is a hyphenated system of the cyber world and the physical systems, our machines, right? So there's a lot of scope of AI, machine learning, cloud computing, right? IoT, those kind of things, and we have to accept it, that this is going to be the way forward. Imaginative and flexible curricular structures. In the future, we expect that curriculums would not be very rigid. There'll be a much more degree of flexibility. And I hope PCI comes up with that. Aim to develop all capacities of human beings. They say, I may be a scientist, I may love science, but I also have leanings towards art. So why do you deny me of a formal structured arts training in one of the courses? I may like to take tabla, I might like to take Bharatnatyam, right? I may like to take yoga, right? I may like to take industrial psychology or psychology per se, or philosophy. So those aspects of the interest of the students should also be allowed to go for other courses which may be of another faculty or fraternity. Let us understand the difference between multidisciplinary, interdisciplinary, and transdisciplinary. You have seen the hackathon, which is conducted by many institutions, including IITs, several names given to it. So, when there is a problem and the solution is found by various disciplines coming together and working towards finding a resolution, right? For example, there's a problem, discipline A, discipline B, discipline C, D, E, all coming together and trying to, which we see in hackathon, right? Pharma students combine, joining hands with humanities, with engineers, to engineering students, with others, students of bioinformatics, for example, and they come out with a solution. Interdisciplinary is where there is a problem and the solution is where a new discipline or field is created when two disciplines come together, A and B. For example, for Industry 4.0, if I want to teach cloud computing and machine learning in continuous manufacturing processes, the engineering field has to come together with pharma, manufacturing, and engineering, and we come out with a new discipline, okay, which is going to be an amalgamation of pharmaceutical engineering, robotics, machine learning, okay, and the AI systems, okay, plus cloud computing. So this is an example of interdisciplinary. Engineering, pharma coming together to cater to the teaching learning requirements or course program requirements, to train our graduates during the program to be ready for Industry 4.0, right? While transdisciplinary is a different gamut. Transdisciplinary, there is a complex problem, okay? Complex problem is not just science or technology related. It may be policy making, design, management, other disciplines, and a new field is created to understand how resolution of a complex problem can be achieved, right? So this is something, for example, now I feel for execution of NEP 2020 in a multidisciplinary framework, it is very important that to solve the problem of ground execution, all policymakers, management, logistics of ABC, handling of students entry exit and change of fluctuating student population per year, handling of students taking courses from other programs, other institutions, which may be from their own university or which may be from another university or a national institute. How do we handle it? It's a complex. So this is a transdisciplinary NEP 2020 execution and finding solutions is all these people should come together, generate a field, how to execute. And I think Samarth is one of them where they are trying to find solutions of execution of NEP 2020. There may be other social, socio-economic or domain related problems as well, where many aspects come into the picture. Socio-economic, social per se, pure, design, policy, the involvement of the IS officers or the executive, in the process. All of these coming together is where the transdisciplinary aspect comes together, and it can be applied to all fields. It's very important to have the multidisciplinary or interdisciplinary focus to collaborate within your cluster, collaborate outside your cluster. And it is very important, my dear colleagues, to understand, although UGCO is opening up to dual courses, right, allowing us to collaborate with foreign universities, but we should tread very carefully, because number one, the foreign funds coming inside India or Indian funds going out, FCRA, there'll be a lot of, we'll be under the radar. What value add is our collaborator going to give you? Is it a synergistic effect? Is it an additive effect? You have a resources, they have similar resources, maybe additive, they may have better resources. But if you have a set of resources, the other institute has a completely different set of resources, both in terms of manpower and infrastructure, that can lead to a synergistic outcome in whatever programs you're utilizing, right? So sharing of knowledge, skills, and techniques, cross fertilization of ideas, confrontation of points of view, which should in turn stimulate creativity, increase in their respective network of contacts, increase of the visibility of the work through dissemination action from both the collaborators, share financial costs and pool resources. For example, my dear colleagues, that now in diagnostics, there's a lot of IoT and real time, this use of technology. So can we collaborate, because this is one area, the diagnostic sector, where our students are not very well versed. So we can plan on collaboration with institutions or companies. Remember, we can also have companies with whom we can collaborate. So can that give that edge to our students? So you need to do your SWOT analysis, right, of your institution. Where do you want to go, right? And what will be your USP of your institution, and decide on the kind of inter and multidisciplinary focus your institute wants to give. Do not try to ape others. So it's very important that institutions today should come together and brainstorm on this. The entire regulatory system is going to change with time. The transformation of regulatory aspect. So what will come under Higher Education Commission of India, that is HECI, National Higher Education Regulatory Council, which will be a single regulator for higher education. So slowly UGC will be phased out. Excludes medical and legal education to regulate in light but tight and facilitative manner. The current UGC chairman said the same thing. We'll be light but tight, right? When they announced how foreign universities will be allowed to set base in India, but that tight will be pretty tight, so as to have complete monitoring by the UGC, so that foreign universities do not undermine and dilute their standards here on Indian soil. National Accreditation Council, NAC, meta accrediting body, specify phased benchmark for all HEIs, including affiliated colleges and the autonomous institutions, set levels of quality, self governance, and autonomy. And that's why you see in the future, NEP is talking about granting the authority to institutions to be degree granting authorities. So then they would not be under the aegis of universities. Imagine the flexibility, but imagine also the onus of responsibility, which is a grave responsibility, which is a serious responsibility, which will be lying to the in with the institutions, the managements and administration and the faculty, right? Because they are the ones who are going to maintain the yardstick benchmarks and quality without, or without any dilution, without any what you call it, faltering. So Higher Education Grants Council will carry out funding and financing activity. Remember, we also disbursement of scholarships. Today UGC major we are not getting, so we are completely relying on DST, DBT, ICMR, and these kind of grants, and also AICT. General Education Council, GEC, will frame expected learning outcomes known as graduate attributes. This is what I was mentioning to you about the Dublin indicators, right? These are nothing but attributes, right? Which we expect. And this is how, when we do our COPO mapping and program specific outcomes, and that is what there where you fit your graduate attributes which we have achieved, and you show your attainments, right? GC will formulate national higher education qualification framework, and we've seen how slowly they are releasing the documents. Now, coming to the National Higher Education Qualification Framework, credits and levels. Undergraduate program, first year, that is only 2 semesters completed, level 5. Undergraduate diploma program, where first 2 years, that is first 4 semesters, is completed, level 6. Bachelor's program, first 3 years of the 4 years, that is 3 year program, level 7. Bachelor's with the honors, which is going to have the fourth year, where research will also be included, level 8. Postgraduate diploma, which will be 1 year after graduation, 1 year, 2 semesters. For those who exit after completion of first year, that is 2 semesters, of the 2 year master's program, level 8. After completing the complete master's program of 4 semesters, level 9, level 9. Level 9 master's program duration 1 year after 4 year honors graduation, likewise BSc 4 years, honors, BA 4 years, or BCom 4 years. Then 2 semesters will also, completing 2 semesters of masters will be level 9, and the doctoral degree will be level 10. You can also see on the right hand side column the total credits which are required. And for level 10 doctoral theses, credits will be for theses, coursework, and published work. Although UGC says that today, because we are seeing predatory journals and the PhD scholars not publishing adequately, and they are compromising. So, but I feel it is very important that from a PhD degree we should get some publication or a patent or some kind of a translation, something, right? It should not happen that there is no outcome expected. And the coursework, which is well defined now, I would like to thank Dr. Supriya Shidhe, Kade sir, who are part of the Board of Studies in Pharmacy, that we have come out with all the PhD coursework, including the research and publication ethics. So it is very important that students take this coursework diligently and then initiate their, or while they are initiating their PhD research. The qualifications at PhD level, which is expected as per the level 10, skills required to perform an accomplished task, technical skills and cognitive skills, the learning, right, the understanding, knowledge for R&D, contribution. So a PhD, a person who has completed PhD should be able to contribute to knowledge, professional practice, and innovation, should be able to conceptualize, design, and implement fundamental or applied research. Skills required for doing transdisciplinary research. Remember, my dear colleagues, that unless a PhD student has a broader scope of understanding and does not have a myopic vision of research, unless that candidate learns how to join the dots, number one, he will not have the vision. If he is not able to join the dots, he will not be able to understand the extension and translation of his knowledge and skills to other domains. And this is what will be a limiting cognitive skills. So we need to have higher order cognitive skills acquired by PhD students. Application of knowledge and skills to design, conduct original and high quality multi or interdisciplinary research. Very important. That's why SNDT, when we had the discussion, they've already started, gearing students to try to identify projects or try to bring in an element of multi or interdisciplinary aspects in their research. If you see in pharma, we are already, pharmaceutics people do a bit of pharmacology. They are already doing pharmaceutical analysis. Can we add more to it? We are doing bioinformatics in the form of CAD, right? Followed by synthesis, followed by in vivo or in vitro evaluations. So I think ingrained in our pharma research is interdisciplinary. But is it multidisciplinary? No. So to add the multidisciplinary element, some people might be conducting, I'm not saying that you're not conducting multidisciplinary, but we have to proactively try to see if some of the proposals, some of the projects can be turned into multidisciplinary by collaborating with other institutions, other research scientists, and teams. Generate evidence-based solutions to complex problems. And for complex problems which will have several verticals to it, facets to it, most of the times it will be multidisciplinary approach which would be required to give an end-to-end solution. Qualifications of PhD level: learning outcomes, listen and read research papers analytical skills, present well structured and logically mannered data, present views on the relevance and applications of recent research and their applications, meet own learning needs related to research and investigations, pursue self paced and self directed learning to upgrade knowledge and skills. So, when we are giving coursework, it is not necessary that all the skills required by that PhD candidate to execute the PhD program correctly, the research project correctly or efficiently is covered in the coursework. So, that candidate is expected to get himself trained, go here and there, go to research facilities, get himself or herself trained so that he or she can execute the project successfully, okay, without compromisation. Identify critical gaps and ask questions. Evaluate the reliability and relevance of evidence. That's why I always tell my students, do not take data. You're a pharmacist. Do not take data on face value. Okay, look into the narrative, understand the fine print of the narrative, try to see whether it is correct or not. Use your knowledge, okay, use your understanding of our domain, past occurrences, precedences, and take a decision on the evidence. Identify logical flaws and holes in the arguments of others. Make judgment. So all of these, as you can see, colleagues, as per the qualification framework level 10, is higher order cognitive skills in our PhD students. And remember, they are the ones who also would go to industry and also be the manpower for academia. So it's very important that these skills, these attributes are inculcated at the PhD program. This is just an observation how, it's a, I'm now going to give some cases to you of multi interdisciplinary. Does narrative medicine education improve nursing students, empathy levels, and academic achievement? Remember, we are learning about universal human values, right? Two are ethics. We are learning about ethics, professional ethics. So here it's about empathy. Remember, healthcare practitioners should have empathy towards the patient and the care. So here students were required to closely read the book and listen to lectures. Their performance was compared to students who were required to listen to patient stories and write patient's parallel chart. So what was the outcome of this study was when the students knew the knowledge, okay, had the knowledge, the book knowledge, the class, that is called it the structured knowledge from the classroom teaching, and added to that, they also were interacting, engaging with the patients, and did a narrative of the patient story. It led to better empathy and understanding of the nurses who are training of the conditions and the patient's plight, and for better care. Okay. NLP, I'm just trying to give you bits where we can collaborate on. Natural language processing can be used even for translations, right? Branch of artificial intelligence aids computers to understand, interpret, and manipulate human language. Helps to bridge the gap between human message and computer understanding. It has huge role in healthcare, in clinical trials, that is drug discovery and development. NLP in healthcare, the natural language processing software, handling the surge, that is big data, clinical data, supporting value based care and population health management, improving patient provider interactions, empowering patients with health literacy, addressing the needs for higher quality healthcare, etc. So these are what NLP can use. So as pharmacists, as being an integral part of healthcare of the country, where can we merge NLP in our research, in our projects, in coming out with a course which is an amalgamation where these softwares can be taught to our students, so students when they pass out they know about the applications of such important platforms once they are in the industry. So you can see here the flow chart of use of NLP in various aspects, okay, in healthcare, including database analysis and interpretation. If you can see here, the data sourcing medical IoT, IoT is also used. Electronic health records are tapped. Medical images, right? So diagnostics, all of this being NLP being used along with AI and ML in the pipeline. Okay, to serve. Okay, for data analysis and visualization tools. Robotics and image guided biopsy. We are aware that in surgicals today, so a doctor, a surgeon cannot say that I'm good with my hands. I have good skills of surgery. So for microsurgery, they are using lot of instrumentation. Lot of equipments and technology is used today in surgical practices. So robotics is one part which improves the outcomes of surgery so as to negate the limitations of human senses. Okay, so you can see here robotic image guided biopsy for localization, acquisition, registration, right, intervention tracking and modeling. So these are aspects which you can see in healthcare already. And we also know about image analysis and machine learning tools, artificial intelligence tools in better diagnosis and prognosis. The integration of AI and e-commerce. Remember, we are also, if you see healthcare, you remember during COVID time, the company 1mg, right, uh, sold so many drugs because many times medicine shops were not open during COVID times, or some drugs were not available. There was short supply. We were people who never tapped the what do you call it, e-commerce for pharma. We did it during COVID times, and now they are popular still, right? And that not only applies to pharma, it applies to cosmeceuticals, wellness services, consultancy. So how do we integrate another patient behavior, patient profiling, right? Customer profiling. Okay. Patient profiling, there is an aspect of confidentiality of patient data, but within a hospital they can do that, use of AI in prescription trends, use of AI in antibiotic stewardship program in large hospitals to minimize irrational use of antibiotics and antimicrobials, to have better longevity of the existing antibiotics which are there in the anvil, because this is a serious issue. This can also be used in tracking in hospital setup, hospital acquired infections, what aseptic practices is best adopted. So a lot of things we can do by following the pattern and coming out with algorithms and conclusions based on that. So AI is transforming shopping experience. So if you go to any site, let's say 1mg, and you've bought certain things, you'll be given prompts for those kind of products, right, to buy again, right? Today you see Alexa can also be used abroad. They are trying to see whether chatbots and these can be used to sell pharma or other products. If you're buying something from Mintra, or you've just seen some photographs of some of the items, which is being sold, consumer products, it will come now flash in whenever you open your computer, and when you are scrolling down, and those will be flashed. So that kind, so there is nothing called privacy in the digital world. You're constantly under radar because you're putting your digital footprints everywhere. So that is one thing where you can tap, right? A student should be aware of it. AI in weather forecasting, meteorology, better weather forecasting. You can see today so much of disruption, California rains. In India, we've seen time and again, cyclonic storms towards the Indian peninsula. Early warning always helps in evacuation of the citizens who are part of the area which is under red, so that we reduce the damage and the mortality, or the associated with the bad weather and the outcomes. So deep learning weather prediction, DLWP model, is uses a convolutional neural network. So it takes initial atmospheric states as inputs. It can be low pressure areas, it can be wind velocities, it can be seasonal changes across the globe, hydrography charts, and then predicts the state of the atmosphere at a given future time. Very similar to, like, we use seismology sciences to predict an earthquake, right? To still we sometimes fail, right? But AI would make it much more precise. So this is what the schematic representation of the cube sphere approach in use of artificial intelligence in weather forecasting. I'm just trying to tell you that meteorology with AI, agriculture with AI, pharma with AI, pharma care or healthcare with AI, and other fields. I'm not going to rule out other fields. There are many other fields with which we can collaborate. Pure science, basic research. We can go to applied with use of the hyphenated cyber systems. It's so many things we can do when we collaborate and we go inter and multidisciplinary. AI in agriculture, I will give you some of the examples. Remember, the SDG goals of United Nations talks about food for all and food security. And we in India, highly populous, You see the southern part of the world, including India, we harbor, if you see the entire southern part of the globe, we harbor the maximum population of the globe, right? So for us, food security for our populace is very important for the government. So how do we improve that? Okay, at the same time, government is stressing on traditional practices of agriculture. If we can find evidences, okay, based on traditional practices without compromising on the yield, and better what you call it, readiness of the soil, okay, every season. We've always practiced seasonal farming in India and we have optimized it, but can we further improve it? Okay, can we also look into Ayurvedic product manufacturing, right? So crop and soil monitoring, insect and plant disease detection, livestock health monitoring. I was just seeing one of the articles yesterday. I was just reading in US. They are also into veterinarian biologics. So one of the companies has designed a vaccine for bees, honeybees, because their honeybees get infected with a peculiar strain of bacteria, and colonies of honeybees get then die. In their what you call it, in their comb, honeycomb. So what they do is that they give the vaccine to the queen bee, and that passes on to the other combs as well. Okay, and that helps prevent the en masse death of the honeybees. So see, because honeybees, as you know, are primary pollinators, and they have a big, what you call it, biomass, right, and play an important role in the ecological balance, including many other insects and many other mammals and non-mammals. But this is something they are doing. We have never thought about something like that, right? Intelligent spraying, with respect to pesticides, herbicides, also with respect to fertilizers. The future of AI in agriculture, farmers. So can artificial engineers can become farmers or be part of the farming industry, right? Produce grading and sorting, the crop produce, aerial survey and imaging. Okay, because remember, when there is a large orchards, you see, so for example, coffee orchards in Brazil, you must have seen that they do aerial spraying and surveying, right? Likewise in India, when there are hectares of land having a uniform cultivation, mostly orchards, etc., automatic weeding, etc., right? Here you can see how observed the crop maturity is understood using AI, collecting images of the crop so that you know when is the time to harvest or pluck, right? The collecting images of crop at different heading stages across 3 years and different lightings. Create a two-step course to find wheat or any other crop year detection mechanism. I would rather write here a crop year detection mechanism. This computer vision model accurately identifies the growth stages and help take decision on the when is the right time to pluck. Remember, we do not for many of the yield and crops, we do not pluck it when they are ripe. They pluck it at the right time so that the inventory, the time required for it to reach from the farmlands to the end users is taken into consideration, and they are at the right stage of ripeness. Okay, when they reach the consumer to be consumed, right? Finding bugs when they do audit, they do bird audit, they know, there is audits and census conducted in Tadoba forest, Kanha forest, name it. Okay, Panna forest, to count essentially the larger mammals, right? But what about insects, which form a huge biomass in our ecological system? So how is it done? What are the strategies we use? Set up a sticky trap to capture 6 different species of live insects, collect real-time images, detection and coarse counting method of YOLO, object detection and classification and fine counting on support vector machines, SVM. For example, you see in India we have incidents when locusts attack our crops. These locusts come from other countries, and there is a migratory pattern of these locusts. It becomes a nuisance for us, right? Because we lose a lot of crop, there's a lot of damage, the villagers are impacted. So can we have a prediction system for the locust movement, for example? There are many aspects which can be studied. Data information, so important is whatever we teach, whatever data is generated by our research, whether it is final year project work, M Farm research, or our PhD, should ultimately get translated to wisdom and insight. And it is our role to see to it that our learners get the wisdom and the insight. Just looking at data is not enough. To convert data to information, information to knowledge, and knowledge to wisdom. And as I told you some time back, wisdom, when does it happen? When that person, that candidate, the graduate, postgraduate, knows to join the dots. And that is also a vision, both insight and a vision, right? Decision making capabilities, okay, translational capabilities, applied understanding. That is what wisdom is, and that is what we are trying to get, after a postgraduate or after a PhD in our learners. For social good, when I'm talking about transdisciplinary, we can collaborate with TIS, Tata Institute of Social Work, or other humanities institutions, department of psychology, policy, institutions which are into policy. This, we can collaborate with the executive, because any policies related to science, healthcare, needs to take into consideration the social requirements, the social stratifications, right? Without that, there won't be proper execution of policies, which are, where the fundamental reason for that policy is some scientific reason, right? So there is where we need to collaborate even with the humanities faculties, humanity colleges, right? And so as to come up with some solutions to problems. Data analytics, as you all know, is a big thing. Statistics, use of artificial intelligence. So, big data, whether it is pharmacovigilance data, whether it is preclinical data, clinical data, or data associated with computer aided designing for the lead identification, AI and data analytics is of great use. For you have to first determine the objective, gather the data, clean the data, interpret the data, and share the results. For AI use in, optimizing the outcomes of a manager. Today, you see, COVID has been such a disruptor, right? You find, I see my MPharm students, many of them are getting jobs and they have just started joining. Many of them are work from home. Could you imagine that in 2019, MPharm students getting jobs with work from home option? Couldn't imagine. So what was not imagined in 19, in 23 is what is getting executed, right? So how do we optimize the role of managers? How, when work from home is being conducted by employees, how do companies track their performance, their actual, what do you call it, deliverables on a daily or hourly basis, right? AI will automate many of the tasks of managers. And what will be the, the optimized, what you call it, time allocation for a manager for what activity? There's a lot of work which goes on to sort of predict gene mutation. We have seen the SARS-CoV virus, right? The Wuhan virus, so to say, which we came across in 2019 December. Then we also got afflicted in March 2020. So many, the initial phase, then the Delta phase, the Omicron phase, and now the Omicron variant, which China is, earlier China was saying all is well during Delta. We are fine. We could not get any figures from China about their, prevalence of the disease. But today they are saying our people are dying because of, but we've not seen that transition that time from China to reach Italy and other parts, Italy and Spain, subsequently US. Italy was affected before us by January, right? And it was such a what do you call it? We were so saddened to see the fate of Italian seniors who were succumbing to COVID. We were not aware what's happening with the serious respiratory distress and inflammatory storm, right? So, can AI be used to predict uh, genetic mutations of both microbial species, viral species, right? To understand what is in the anvil, what should we brace ourselves for? It will help our preparedness. For example, when it came to SARS, we were totally unprepared, right? Role for humanities and inter and transdisciplinary. You have to understand whatever scientific findings are, ultimately it has to be executed in society. Government has to come out with policies. Okay, policies, for example, on generic drugs. Okay, government policies on execution of diagnostics for the the municipal hospitals, for the government hospitals, whatever policies are there. So to understand the correct execution of them, we also need to get a social picture of the challenges. Okay, when the dots program gets executed for the new for tuberculosis, what are the ground level challenges? I know because of IPA and RX and students nowadays, most of the colleges have adopted villages. They go out into the field, but that should be more structured now in our education. Instead of just doing it as a social responsibility, can we gather data? Can we make sense of the data? Then our students just going to railway stations, going to villages, going to hospitals, creating awareness. More than that, can we make a sense of whatever is being encountered and captured using the correct qualitative or quantitative tools? Remember, students should also know how to frame questionnaires, etc. That's also an art. There is a science behind it. Okay, so it's very important for us to understand that policies are executed best when scientists also understand the ground level realities of society. Scientists understand the ground level realities of the disease and the patient, right? Okay, now I added this to my presentation. How do we get research into our classroom? Karjat College, VESCO, you all are doing so many things to encourage undergraduate and postgraduate research. How do we encourage that instead of just pushing during Avishkar, before Avishkar, or before having a convention on innovation and research? It should be ingrained in our ecosystem. Okay, how do we ingrain it in our ecosystem? We are aware that institutions have their innovation council. So it's important that we conduct various innovation and entrepreneurship related activities throughout the year. Colleges need to plan it out, like a plan, yearly plan, identify and reward innovations, share the success stories, because success stories, when shared, triggers, it triggers others to go into the path of innovation. Organize periodic interaction with entrepreneurs, investors, professionals. Organize hackathons, idea competitions. I know we are doing it. Let's make it a practice, a yearly practice of sequence of events, mini challenges with the involvement of industry. Network with peers and national entrepreneurship development organizations. Create a mentor pool for student innovators. You can make a mentor pool of your alumni. You can make a mentor pool of successful entrepreneurs. Okay, and you can connect them to the venture capitalists, right, the angel investors. If there is merit for commercialization, it's sure to be lapped up, because money is there, funds are there, idea is most important. If there is merit in the idea and the translational value, there will be takers. Undergraduate involvement in research project, I've taken this from the Roskilde University. We now today in semester 7 and semester 8, semester 7 you have practice school as per PCI syllabus, semester 8 you have project work. So give problem oriented project work, because what we are seeing is, why are our students lacking? Why do our the companies which recruit them have some grievances about the readiness of our, is because our theory and practicals does not culminate into our students understanding on application in the industry, right? They somehow take things standalone, and they are not able to, as I said, I repeat, to join the dots and think about the application of what being taught to them in the theory lectures, and what is being the skills being provided to them in the practical laboratories, right? And these research projects is a best what you call it endeavor, wherein we can bridge that gap, that limitation which the learner has between skills needed in today's skilled professionals, and to partake a research endeavor partly based on a strong tradition of interdisciplinary research. Remember, my student might be working on, let's say, simple, let's say anti-inflammatory product, or they might be working on hand sanitizers. The project, whatever you are giving, There are many elements which a students learns. They will do a market survey, they will learn to do literature survey, then they will try to design a protocol or what activity they are going to do, whether they're going to collect data, they are going to have questionnaires, what will be the target audience of their questionnaires, how do they take permissions for the same. Once they capture data, are they open-ended data, close-ended data, laboratory data, how do they make sense of it, what is the statistics, and after they do that, what do they infer from it, or does it have an application. So many attributes, it's that time itself gets inculcated into the student while they are performing and executing the simplest of project work in the semester 8. So semester course introduction, project group formulation, supervisor allocation, startup seminar. Just don't give them a project and say, "Abhi, now you fend for yourself." Timetable maybe dikhta nahi hai when they are going to do the project work. Have a startup presentation seminar between the mentor and the students. They may call senior students to advise, a colloquium kind of a thing, midterm project evaluation. Don't tell them in March, April, abhi dikhao result, give a presentation, give a report, story over. No. How do you know those attributes have been garnered by the student? And they try to give interdisciplinary project to them. Some management, there will be sales data, marketing data, warehousing, cold chain management. Include all these elements so that they think, they understand the ground realities. Analytical workshop and examination of the performance. Supervision is required across the research project. Now, today, if you see, undergrads can be involved in interdisciplinary research. During practice school, we can give them first-hand experience of machineries, equipments, how to go about research. They can they can participate in Avishkar, your college convention, other colleges convention, okay, research conferences, etc. Collaborative projects which involve inter, multi, or transdisciplinary focus. Mentorship by industry personnel helps a lot in improving the outcome of the research project of final year. Because teachers also many times do not have a what you call it pragmatic contemporary understanding of a particular industry or a particular domain. So when an industry expert also comes as a mentor along with the faculty, it really adds a quantum of improvement in the quality of research and will certainly add interdisciplinary elements to the project. Field based projects can be given, community pharmacy programs. It's not necessary. If don't think that I don't have a pharmacology lab, I don't have a very evolved pharmaceutics lab, no need. Give community pharmacy programs, healthcare campaigns, curiosity of understanding the various aspects of healthcare and pharma domain. Okay, so this there are so many options. Abroad, if you see, the final year project, which we now call it as a semi project, is called as capstone project, is a culmination of integration of the knowledge and skills which students have. So we also, pharma faculty, should look at the SEM 8 students project, which is their research project, in the same manner. How do we culminate into integration of the knowledge and skills which they have garnered from SEM 1 to SEM 7? Okay. It prepares them for the outside world. Okay. I always talk about the innovation index, global innovation index, the GII, which is declared by WIPO, uh, the World Intellectual Property Organization, how India has jumped. In 2015, we were ranked 81st. In 2022, India is ranked 40. So one of the main reason for improvement of the rank is spurred by our startups, our innovation driven startups, our phenomenal growth in certain sectors including technology, e-commerce, right? And also remember, we also want that this GII improvement of India should also, like the Western world, like Switzerland and US, should be contributed to a large extent by academic research and innovation, which is directly or indirectly contributed by academia. So you see here, top 10 countries by number of startups. Okay, India, not bad. So see the growing industry, healthcare, transportation, financial services, artificial intelligence, e-commerce, right? So, but we can do much, much better. Okay. That's why our startups should have a robust base with a product or services which they have done thorough work to pitch, right? So it's very essential that we groom our students to be entrepreneurs, to have their startups, so that they can also employ students and create jobs. Startup India for Prosperous India. New incentives for startups. So, as academicians, as institutions, what can we do? Okay, other than collaborations in incentivizing students into innovative thoughts and into entrepreneurship spirits, okay, we can have incubation centers or tie up with incubation centers to handhold our students. It's very important to handhold our students. Students do not understand ACZ, they do not understand loans, funding, incubation centers, legality, licenses, IPR, right? All these things, taxes. So we need to handhold, give them all this support, funds. If even if institutes doesn't give, we can connect them to industries, to venture capitalists, so that a project which has merit, an idea which has merit, gets translated, and that also brings laurel to the industry, to the academia, and we are contributing to the economy of the country, indirectly and also directly. You could be the CEO of the next big name we might get to hear in the years to come. Remember, IITs, ISers now are allowing faculty also, remember, to have their startups. There's a big, when we say project work in final year, sem 8, there's a big science of project based learning, which is a pedagogical theory, right? What are you skills are you giving to your student when you are starting with now your sem 8 project work, which can be interdisciplinary, which can be transdisciplinary? Authenticity, give them projects which is real world need, concern, problem. Ask them to look into the inquiry, ask them to do the literature survey, find out marketing, prescription trends, okay, about that area. Find out, listen to the students' voice and choice. Do not impose on students. Today, NEP 2020 is opposite to imposition on students. Give them flexibility, give them a voice. Faculty should hear them and then speak to them. Okay, let there be a brainstorming, collaborate, provide them employability skills when you're giving them the projects. Indirectly, they were garnering, writing a letter also for asking for a gift sample, communicating with their seniors who are alumni. All these things are also skills, soft skills, communication skills, which is part of, remember, the Dublin indicators. Community partners, they should know the community partners. Feedback and revision, always have a monitoring, what do you call it, system of the project. Presentation, let them present and reflect, have standards on content, knowledge and skills. So this is project based learning. This you can actually take, teachers can train themselves how to provide project based learning to students. Okay, so doing projects, the right technology can make the difference. Project based learning forces to students see learning differently, unlike the classroom learning and the laboratory training which we give. Developing quality essential, okay, which during practice they will need. Patience, it empowers the students and parents must understand the process. Remember, we often tend to give our projects as a team, 2 students, 4 students. So teamwork also they will learn, right? They will brainstorm, they will optimize how to conduct the research or the project. So that all helps in building traits in them which will be required when they are employed and in the industry. So, if you see, there is a consortium in 2023 January. This is coming up. It's a consortium of several university which are coming together to form the Eureka Pro Alliance 2023, and they are going to implement an interdisciplinary project based learning. They are initiating the project. Okay, this is the Eureka Pro partner universities academic staff to provide basic theoretical and practical knowledge and skills that allow to effectively implement interdisciplinary project based learning programs in the academic curricula. So we too need to relook at how we are executing project based learning in sem 8. Is it a capstone project? What kind of titles are we giving them? What kind of triggers are we giving to the students to think and execute the project? In the end, what traits, what attributes, what graduate attributes are they incorporating in themselves, imbibing at the end of the project work? Okay. Remember, today NEP 2020 and UGC chairman time and again is talking about higher level cognitive skills and learning in your students. What is higher level cognitive learning? Okay. Use. Use information, concept, or theories in new situations. New situations, time changes, paradigm changes happen in technologies. Okay. So you see how 2005 clinical trials and clinical drug discovery development was, and today there is a vast difference. COVID again has made so many changes, rapid, expedited research and review of vaccine trials, right? Predict consequences and outcomes, predict, solve problems in which students must select the approach to use to solve the problem. Break down a problem into parts, understanding a problem, issue, or a project in parts. Okay. Okay, that understanding, otherwise so it is lower level learning. That person cannot be a leader or cannot go into a higher level corporate position, right? Identify the critical components of the problem, of the new problem. See the pattern and organization of parts. Classify, order. Okay. Determine the quality, importance of different pieces of information. Discriminate amongst ideas. Make choices based on informed decision, knowledge, skills. Okay. So how do you impart these? Does the SEM 7 students have this? Does the SEM first year M-Farm student have these traits? No. Can we incorporate some of these higher level cognitive traits in our project work of final year SEM 8 B Farm, second year M Farm project, and also the entire PhD project? Higher level cognitive learning we can enable it in the PCI practice school, okay, with knowledge and skills in unfamiliar and open-ended real life situations. In the SEM 8 project work, problem based research design, curating questions for survey. Students should understand a Google questionnaire bana diya, Google doc banaya. It doesn't work that way. The questions have to be decided. There's a science to making qualitative research, right? And there is a science behind quantitative research. So those traits we teachers have to give them before they initiate their project work. Incorporate employability skills like critical thinking, communication, collaboration, technology use, etc. I conclude that holistic education will upgrade. You see, even for undergrad program, the skills framework is talking about holistic education to upgrade the capabilities of skills of students from KG to PG. Multi, inter, transdisciplinary approach towards PhD research promises to expose to wide variety of data transformation into fruitful outcome for the betterment of human society. Building an India centric education system that provides high quality education to all, which will increase the gross enrollment ratio to 100% in preschool to secondary level by 2030, and higher education target of GR to 50% by 2035. We have 10 more years, 12 more years to go. Rather, I'll say 13 more years to go. Average this even in Mumbai University, if you see around 23 to 25%, if you see Palghar 16%, there's a disparity. Reaching 50% is a tall target of gross enrollment ratio. Enhancement of education and skills to shape a future that works for all of us by putting people first and empowering them, paving the way towards fourth industrial revolution, as I said, which is a hyphenated system of machines, physical systems, hyphenated with the cyber world and the cyber technologies. Young entrepreneurs are required to create jobs with the surging population, graduates, right? And the aspirational young India, right? We need jobs, increase innovation, raise competition, and are responsive to changing economic opportunities and trends. Entire education system to be reconfigured to support and foster the critical targets and goals of sustainable development goals, which has been articulated by United Nations, which has been adopted by India. We need to have quality, accessible education, higher education, right? Equitable, quality, high accessible higher education, and that's what we are working towards. Yes, I can see the lovely faces of my students in this photograph. So students need to be equipped with both skills and knowledge to make them occupation ready. The NEP 2020 is trying to create an ecosystem for innovation and entrepreneurship. Innovation cannot be holistic, understanding cannot be holistic without our students understanding the interdisciplinary focus which are required, and institutions turning to multidisciplinary focus across faculties. Right? Thank you.
Thank you, madam, for such a wonderful and informative talk. If any questions are there, we can take.
Yes, we can take questions. Should I check it in comments, right, to see whether there are questions? Thank you, Kale sir. You are always very appreciative. uh, Vaishali ma'am,
Uh,
can you help me with the questions? I am not
no,
able to.
my question will be
Yes,
uh,
sir.
simple. Uh, Pharmacy and medicine, is there any scope to combine together, integrate them, or have some collaboration type of arrangement in education?
Yes, I think PCI has already initiated the trend. They've asked us to employ a PharmD with a PhD or a PharmD graduate as a faculty in practice, pharmacy practice. And that's the reason, the moment practice comes, we have to collaborate with hospitals. And so we can certainly, all these aspects of pharmacovigilance, drug information, patient compliance, all these things would come when we collaborate with medicine schools, and add that part in our, in our program, and that will be very much relevant. Because today, if you see, I'm sure during your NAC also, the NAC also nowadays is asking questions on how we are contributing to the practice of healthcare. Prima facie, if you see, our curricula was earlier, was very industrial pharmacy oriented, which now has become quite a bit on, on clinical. But our students do not get, unless we are sending them for some internship in a hospital setup, do not essentially get too much of exposure to the hospital requirement, the hospital pharmacy requirement, the community pharmacy requirement. But yes, that is one part which I think PCI today is stressing on, and that is the reason that they want us to employ at least one faculty in pharmacy practice.
Well, I wish what you have answered, it is in the near future we can see.
Hopefully, sir.
Because
Yes.
I doubt still the hospitals are not, unless the government put the rule, things will not improve on that.
So
And I think
yes,
you should at a particular level start working on this point and also see that the pharmacy and medicine, they should come very close.
yes, sir.
That is my point.
Sir, I think the PCI has not yet come out with the NEP, their syllabus change, curriculum framework change in line with NEP 2020. We are waiting for it. So the moment PCI comes with that, we'll be able to get a clear picture on what is the focus going to be with of our B Farm and M Farm. This they are not going to undermine the classical core branches, but I'm sure they are going to strengthen the practice element in our program. So that will help us bridge collaborations with medicine colleges or medical colleges or schools and add those parts. Another thing, if you see, WHO is very concerned about infection prevention in hospital setup, infection prevention and control, which hardcore the surgeons and the physicians don't do. The pharma, B-Farm, many candidates have been employed in the hospital setup. Then in sterile processes, customized therapy for patients, customized individualized therapy for patients in hospitals, the pharmacists are involved. So I think that needs to be more structured and our role should be more appreciated. If you see during COVID also, it was the pharmacists who gave a phenomenal service to citizens during the lockdown periods. Many of the clinics, small clinics, were closed. So it was the pharmacists, it was the retailers who were counseling and giving essential medicines. Because the citizens would have access to doctors only through online consultancies or were not able to access them. But the retail outlets were open during all the phases of lockdown. So that I think government should take cognizance that during such emergency situations, the contingencies are maintained by the pharmacists. I hope I answered you, Bilani sir.
Sir, has she answered your question? Ma'am, I have one question. May I?
Yes, ma'am.
You very nicely you explained about the entire scope for multidisciplinary research and interdisciplinary research and how it can be applied to pharmacy, healthcare industry, diagnostic industry. It was very enlightening session. I just have a direct question about this project-based learning opportunities, problem-based learning opportunities, where you have emphasized on significance of industry working as a mentor, collaborator, and guiding students so that the research becomes more industry relevant. So can there be a possibility like how for medical college, it being a professional course, there the internship is mandatory before they get an official degree, and that internship is on the job internship. They are actually working as a doctor. So is it possible that there will be some kind of policies that would be suggested to the government by way of which the industry also will be compelled to handhold with the institution, and that internship becomes a part of the course, whereby we don't have to keep on pleading the industry, but it becomes a mandate. The industry has to adopt 5 colleges. So what do you think, ma'am? Is it a
I think that is a very good suggestion because in between, government was stressing on apprenticeship embedded programs, for especially professional courses and skill based courses. But the moment we talk about apprenticeship embedded programs, there's a minimum wage which the industry has to give. I think 8,000 rupees per month. So if they are going for a month, but if we can have an internship where they don't have any financial liability and they can adopt, as you said, a couple of colleges based on their departments and their size, our students can actually what is happening is today with industrial training, sometimes students are not doing justice to the period of training, and that has become an industry also doesn't sometimes takes it seriously, does not really rotate them between departments and give them an exposure because of many concerns. They are also maybe short staff or they have regulatory concerns, etc. So we'll have to restructure this and make it, as you said, a more binding for industry to actually handhold academia and colleges so that our students get a real world exposure during their undergraduate or during their program through internship, but very structured. And if that same company can also allocate their personnel for our final year project based on case to case basis, their domain expertise, it will be good because then the real life problems or our domain problems can be given as project to our students. And that can also be related to marketing, sales, product development, pitching, anything. So It's not just hardcore. We have to give AI or technology driven projects, pharma technology cusp projects. We can give them anything where the student is interested.
Thank you, madam. Thank you.
Now, I would like to request Anuja Jagdale madam from KGRDCP to give vote of thanks.
Am I audible, ma'am?
Yes.
Yeah. Thank you, ma'am. I, Anuja Jagdale, Assistant Professor of Konkan Gyanpeeth, Rahul Dharkar College of Pharmacy and Research Institute. It's my privilege and honor to propose the vote of thanks. I would like to thank our resource person, Dr. Anuradha Majumdar, the former Dean, Faculty of Science and Technology, University of Mumbai, for enlightening us on the topic Interdisciplinary Research in Pharmacy, that is National Education Policy 2020 Perspective. I would like to summarize some points ma'am has enlightened us. That is, the first thing is that ma'am has told us that we should apply the knowledge and understanding. Second, the communication skill. Third, learning skill for the higher education. These are the main aspect we should have to apply. Then ma'am has elaborated on the holistic and multidisciplinary education, difference between the multidisciplinary, interdisciplinary, transdisciplinary, then collaborative research, SWOT analysis. The institute should be done by the institute where to go and how. Then transforming the regulatory system of higher education, which works on the four verticals of HECI, that is Higher Education Commission of India. Then natural language processing, which work on the handle, support, improve, empower, address, identify, which works with together with AI, that is artificial intelligence in pipeline. Also, ma'am has elaborated on the elaborate on the examples of artificial intelligence in weather forecasting, AI in agriculture, then data information knowledge and wisdom, data analytics, role for the humanities and interdisciplinary research for public policy, we encourage research in classroom, and the last thing is that higher level cognitive learning, which work on the use, predict, solve, break down, identify, see, determine, discriminate, and make. Thank you, ma'am, for your wonderful and inspirational session, and it was very knowledgeable, ma'am. Thank you. Now, I would like to thank the management team of VESCOP and KGRDCP for providing all necessary facilities. And then I would also like to extend the vote of thanks Dr. Supriya Sidde, Principal of Vivekanand Education Society, College of Pharmacy, Chembur, and Dr. Mohan Kale, Principal of Konkan Gyanpeeth, Rahul Dharkar College of Pharmacy and Research Institute, for your valuable support and guidance. I would also like to thank coordinator of today's program, that is Dr. Amol Sandekar and Dr. Vaishali Zadav. Thank you, ma'am. Then I will also like to thank the technical team for technical support. And the last but not the least, thanks to all the participants for patiently listening the entire session and actively participate. Thank you. The participant will receive the certificate within 2-3 days of working. Thank you.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you so